Hi, everybody. It's nice to see you today. It's really nice to see you because I get to say some stuff that is on my mind, and you actually might want to hear it. I mean, maybe you don't want to hear it, but you might want to hear it, whereas most of my friends, just don't want to hear it. So it's nice to be in a room where what I'm about to say is somehow useful and not just something to walk away from. So my name's Kathryn. I'm the Chief Scientific Officer here at SYNGAP1. And if you saw me yesterday and I looked like I didn't know what was happening, it's because I was heads down in AV. And I'm glad it's today, and I'm glad I get to look up and see your faces and see your kids. Erin here, I've known, and Erin and Virginia I've known for a really long time. We met before. And Marta, did I meet you too then? Well, anyway, I might have met I met all three of them before. Sorry. You met her. Eventually I met her. I think I heard about her more before I met her. But anyway, we've known each other a long time, and we all have older children, and we've lived through a lot. We've lived through babyhood, preschool, elementary school, middle school, high school, and for a bunch of us who transitioned to adulthood. And I'll have to say that things changed over time. And I always thought I knew what was going on, and I always thought I was a good mom. And to look back and see some of the things I thought then and what I think now, it's a really interesting journey. I'll just say my kids taught me a lot. My kids taught me a lot about being a parent. He's taught me a lot about being a human. I've never met a human as different from me as my son, and I've never loved a human more fiercely than I love my son, and so we're gonna have a real honest discussion with you. So the way it'll go is we'll each talk for a couple minutes and tell you about how we survived really challenging behaviors, what our strategies were, what worked. So like I said, our kids weren't, like if you met my 24-year-old, you wouldn't see who he was as a chubby little 14-month-old, right? So here he is at 14 months. I don't know if you can see how glistening he is. He was always really drooly. And I don't know if you can see how soft his skin is. It's still exactly that soft. At 11 years, I think he looks a little bit like Ty, honestly, but Virginia isn't paying attention. Do you think Joey looks like Ty at 11 years?
Yes.
Yes, that's a yes. Well, he's running for one thing. so at 11, he was happy a lot of the time, except for when he was terribly, terribly unhappy. And now at 24, I chose that picture because he's looking up at his caregiver with like such sort of love and awe. I really love that picture. I wanted to have the caregiver in it too, but I was like, it's not about that. But just wanted you to see he really is looking into that guy's eyes and really pays attention. So I wanted to go over what his diagnoses have been. So early on, he had global delays. From the get-go, he had trouble with feeding, sleeping, communication, and a lot of lethargy. And right before he turned 4, he got an autism diagnosis. So at 11 years old, he had an autism diagnosis, severe or profound intellectual disability. That doesn't really start until around 8. So if you have developmental delays early, they either go away or they sort of turn into an intellectual disability diagnosis. But you never seem to get that early. That's kind of you have to like have gone through enough time and enough chances, basically, before that's a diagnosis. The diagnoses there are in bold, but under that, he had a BIP, that's a behavior intervention plan at school, and that was mostly for biting, elopement, and aggression. And I'll tell you, before I had kids, I was really nervous. I was like, I wonder what my kids will be like. I have 3 boys, and Joey's my middle one. And I thought, what would be the worst case scenario, right? Like, I'm a stoic, kind of Norwegian-bred person, so I was like, what's the worst thing that could happen? I was like, he could be aggressive. I would be so upset if he was aggressive. I don't think I could take it. And I have this, like, incredibly aggressive little boy, and I love him so much, and I don't really care. Like, that's not the problem, right? That's not it. So, at that point, too, I'd put 4 walks a day in his IEP. So he went to school, but he didn't want to be in school. And so I made sure that he could get out of the classroom 4 times every single day with an aide. It's 100% one-on-one. Like, this boy is not ever really left alone. So now at 24 years, his diagnoses include intractable epilepsy, disruptive behavior, anxiety, language impairment, eating disorder, which surprised me, but he's incredibly underweight. He eats a lot and doesn't gain weight, so I feel that that's probably an incorrect diagnosis, but at least it kind of gets into the fact that his BMI has been in an unhealthy range. SYNGAP1 related disorder, which is the big one, and decreased bone density. Okay, so what were the problem behaviors? You know, they were the same behaviors as when he was little, they just became crisis. Okay, so he'd bite his hand and kind of gnaw on his hand when he was little, but it didn't mean anything until he could break the skin. He would pull my hair or fight or not move. You know, I remember having a conversation with somebody in my early baby group, and they're like, oh, we just couldn't get out of the house. Our 18-month-old wouldn't let us get out of the house. And I was like, what are you talking about? You're like, you just go out of the house. It's like, how was that the problem, right? And so, but then later you're like, oh yeah, that was a problem, right? Like I couldn't do it. I physically couldn't do it. We couldn't get out of the house. And so his size, strength, coordination, and determination were all up. That's why it got harder. The physical safety risks, I put in percentages there. I think at home, both to himself and others, like to himself, his family, his siblings, caregivers, I'd say about 5% of the time maybe we had physical safety risk issues. In the car, maybe more like 10% of the time. School, more like 30% of the time because he didn't want to be there. And out in the world, it was just really variable whether we felt really safe or not. Our strategies were all just looking for an antecedent. That's basically what we got from ABA, look for the antecedent. And my state was fear, guilt, shame, overwhelm, and exhaustion. So what really worked for us was radical change. His environment changed, his task demands changed, they went down, his agency went up, agency meaning what he was allowed to do, what he was able to do, how he was able to move his body around in space, and then not being around me. That part feels hard and shameful to say, but I understand him and I can get him a lot of stuff and he remembers that. And from what I've learned as in the last few years on the science side is that our kids have trouble learning, but if they're emotionally attached, they have a really hard time forgetting. And so it's even harder to forget something you want than it is to learn something new. And so not being around me, I think, reduced his anxiety levels because when he was around me, I was the like get all the things person, and he'd sort of expected that. And when he wasn't around me, he was more calm. He didn't expect all the things. And so there wasn't an unmet expectation because I wasn't there. He needed less visual overwhelm. And that's about it. And I'm gonna stop with what I learned. His big behaviors were communication. Everything he did was saying no to me in a louder, more insistent way to make me hear him. He needed something different. And what I've learned to do on the positive side is watch for his engagement and his neutrality. He shouldn't be unhappy, he shouldn't be too happy. Too happy is honestly just as bad as unhappy because it leads to being unhappy later because of this sort of addiction cycle. So I watch for neutrality and engagement, and I put this photo of him because it's kind of like the perfect depiction of how hard it is to find neutral engagement because I did not want to be in the water. This is cold, salt water in the Pacific Northwest. I did not want to be in this water. I didn't have clothes he's in his tennis shoes, like we didn't have clothes to go in the water. But this is what he wanted. This is where he had like the sort of engagement and neutrality, and I let it happen because I felt like that was better than like other things we could do, iPad, sugar, like all the other, favorite song, whatever. Okay, I know I talked way too long because I was first.
Thank you. Of course.
But what I didn't say was he moved out of our house at 12 and a half, and it just about killed me, and it was my choice. And I didn't think it would work, and it did, and then that even killed me more. Okay, go ahead.
My name is Aaron. I've done the introduction earlier. One thing about my impact on Jackson's life is we were a military family, so we moved around a lot. So that created a lot of disruptions in his life, having to change providers and go through the many years of behaviors that we've dealt with. But I want to just first start off and say, if you want to talk about the sort of the historical spectrum of behaviors, I would highly recommend you talk to, or at least you see the movie Karen, and listen from Nancy about what life is like in a very different era of our society when it comes to how behaviors are perceived and how they're treated and dealt with. And Karen, Nancy has gotten to know our ABA therapist, Yemi, who many of you might have, hopefully you've heard from her in some of the webinars she's done, but many of the families who have consulted with her. She's been a life changer in so many different ways, and probably has violated many provider perspective engagements, but she's a big part of our family, and she's been so helpful to many. But again, if you've seen, we have a movie about Jackson, so much of this has already been disclosed, and all of these continue to be true. But when we're focusing on, well, I'll give you two hopes. One, it's still possible as a teenager, if you haven't already had them potty trained, to potty train them and get them out of diapers. So I just, LMA helped publish some information on how to do that, but there is a lot of the behavioral parts of life that can happen that you can train them to do it. And so I really encourage you that your child can get out of diapers. And we believe that during COVID, and we worked hardly at it because we knew 20-year-olds that we had read that were able to do it, and largely. Now, not that he doesn't have pee accidents here and there. We still do, and he holds his urine for 20 hours a day, which is ridiculous. But recently we were diagnosed with bipolar disorder. And from the behavioral perspective, now, mind you, I need to tell you is that my father had bipolar. I don't yet. But what we've learned from the bipolar diagnosis, I'm going to kind of go off script because behaviors have been from 3 to now. I got a picture yesterday morning of Jackson waking up out of his bed, running across the house, and tearing the TV off the wall. And this was just, awakening and running. We have no reason, we don't understand why. This has caused obviously a tremendous amount of heightened nervous system, hypervigilance with Monica, myself. Monica definitely, by the way, I should say, these slides have been approved by Monica, but what I say has not. But then we do experience chronic PSD because we're always in this state of constant alertness, which is not healthy to our nervous system. Sleep disturbances, you name it, it's 24/7. But he essentially requires 2-on-1 the vast majority of the time. But I'm going to tell you about behaviors is that I do believe with this bipolar diagnosis, and I do think our kids do exhibit different types of behaviors, and it's difficult to understand it because in psychiatry, behaviors are very difficult to categorize, but we're working really hard with our psychiatrist to try to work to differentiate the different types of behaviors that are mania or mania-like and what are actually behaviors. And so we're on this journey to try to understand that and really try to understand the neurobiology of how maybe that relates to SYNGAP1 and these mechanisms that relate to, again, it may not be bipolar, but I think it has mania-like characteristics. And then again, how we might be able to help you understand how to differentiate them, because if you can't differentiate them, you're not going to approach them like Kathryn explained, or like we did from CHOP explained, that you're going to tackle them differently in your approaches in order to prevent them from happening. But ABA therapy, customized, traditional ABA does not work. But when you customize and understand the totality of the individual, which most ABA therapists, BCBAs, I would say arguably do not get the type of holistic approach to the clinical aspect and understanding drug and understanding the differentiating behaviors, but trying to really, that your practitioner really help to engage in that fashion. But I would like to say that, again, Jackson intends to communicate, emotional spatial awareness. He has amazing memory through iPads and pictures like many of you. Can multitask on the iPad because he'll have a video up on the YouTube and he'll have pictures in the corner and he's swiping through like crazy to find exactly what he wants to find. And I know all of you experience that because they all have Syngap. But one of the things I do want to point out that will never be discussed, but I want to bring it up because I've talked with a few of you about this, is our family, and we disclose this in the movies, that we're in therapy. We're in therapy because as a family and as a couple, as couples, you need it. Siblings are part of that, and you can see my daughters, they've been impacted because they've had the heck beaten out of them in the car. But they need therapy and they need someone to talk to and they need that engagement. Couples, husbands, we come home and we had a great day, maybe. But our wives and our spouses, we think everything was just fine. And again, these emotional attachments and these emotional connectedness through emotional intelligence, which I've been told I have to work on, I'm working on it. Is that I do show, and I asked, I said, what is an emotion and what does it mean to do that? Because us as men, and having been in the military with men and women who serve, who commit suicide, often internalize everything that's negative about them. And they won't share with you, and they close down, and they won't talk about it. Men, we don't talk about it. We're an island, and we always have been, but we need to share that experience, this experience with our spouse. This disease will disrupt your intimacy, every spectrum of the intimacy, from hugging to the other end of the spectrum. And as women, as my wife has gone through menopause, again, mind you, she hasn't approved what I've said, but as she's gone through this during COVID and said, I didn't even realize it, it changes. There's things that are changing. And we will never talk about it. It's never talked about. But I want to tell you, I want to start the conversation today because I want the families to be in here to be united as one, because you can't do it without each other. These behaviors will challenge you, and it's not their fault. I've told Alex Hall when I first met him and I saw Oliver tearing the heck out of him, I told him, Alex, it's not his fault. And don't hold back every emotion that you have to control what's happening. It's not their fault. We have to love them and improve the quality of their life and do everything we can to improve the quality of their life, because they're going to live long, just as Karen, just as our other family that was diagnosed, who's 60. They're going to live a long life, and they're going to have these behaviors and challenges their entire life. And what are you going to do to set that up? So I encourage you to start the conversations, but I encourage you as husband and wife, as partners, to love each other and give each other grace and patience in everything that you do, because you need it, and you're going to have it every step of the way. So again, thank you. And by the way, I found out we're starting lithium going into the holidays, and it's a pretty tough drug. But I've learned a lot about it from just a lot of discussions that Kathryn has helped to sort of ignite, and recognizing that is in this whole GSK3 pathway, whatever. But that I think it can help Jackson. But the question is, it's used in pediatrics and adolescents in certain conditions. So the question is it's not an easy drug to use, but potentially we're going to start on that pathway. And again, thank you. And again, from my family to your family and Monica, we love you, and we're here to support you on this journey as well.
Okay, my name is Marta, Dahiya. I'm the mom of Sophia. The reason why I'm here is we tried to show 3 different kind of family lives. Kathryn had to, like she said, had her son going somewhere else to live because it was the best situation for him, was what was best. Aaron still have his son full-time at home with Monica, and Aaron is lucky he has 2 great daughters. Then they help a lot. And I have a kind of an in-between challenge. I have my daughter part-time with me, part-time with somebody that I'm very grateful to help me to take care of her. Then Sophia's 23 now, very similar to all the journeys. We got basically she got all the diagnosis of Syngap. She's on the severe side of the Syngap. She got the diagnosis of Syngap when she was 11 years old. And then after that, I was grateful, little by little, I got into the community of Syngap, and that has been very good for us. It has been very helpful because before those 11 or more years, 14 years before I had a community, it was super hard. I didn't have anybody who lived like us. Then it was very, very difficult. Sophia now, I mean, she has intractable epilepsy, she has severe OCD, she's severe. We are in psychiatric treatment. She has some problems, scoliosis because the hypotonia, some contractures, but she does pretty good. Then she had more challenge with her behaviors. Really, she started to be very hyper at age of 2. Like she would run like crazy everywhere, and her ADHD was very bad. They would call me from school. She got kicked out of the kindergarten because they couldn't even have her sitting for 1 second in one place. Then, of course, I had the cry that nobody want to take care of her, and all that stuff that went along. Then I found the school system. They helped me out, but always with a lot of issues, a lot of behaviors. I have to fight the school system to give me one-to-one support because she kept running through the whole school, climbing, everything. As soon as Sophia started getting taller, she's my same size, a little bit taller than me. She noticed that. 12 years old, she will beat everybody up at home. She was able to do a lot of harm. Then that was pretty rough. When we were I couldn't take her to the grocery store or in the car because she will jump. In the grocery store, it was very difficult because if she heard a kid crying next on the aisle or something, she will want to punch the kid or the baby. Then it was quite a challenge. She will hit a lot, and the worst moment happened when she was around 15. I seriously couldn't take her anywhere or be anywhere with her. And it was a lot of fear, and emotionally it was very hard. The life of the family changed, a lot of family conflict. I became a single mom. That is, I think, is a representation that is very common also. No, everybody has a spouse, and it's something that happens commonly, and when you have a kid with problems, happen more. Then the challenge, as soon as I became a single mom, was what I'm gonna do with her. And I had to get with my ABA therapist, that is a second mom to Sophia, and basically I moved to live with them. I used to work on the weekdays because I have to maintain Sophia and all the stuff. And then live with them on the weekends because her behavior was so bad that I couldn't be alone safely with her. And she pretty much, we passed 9 months, basically almost restraining Sophia, hours and hours of the day, and passing between 3 adults, Sophia around, because she was that so bad. Little by little, with a lot of ABA therapy, she got better. She got much better. We changed all her environment. Then all the stuff her room that was decorated, everything became very plain in our house. When I was able to take Sophia back to my house, I didn't have even paints, nothing. Her room was the bed, and basically that's it. Her bathroom, all the towels are white. I took everything that was like an extra things that she could grab or hurt herself or anything, and it worked. I think it helped her a lot. I did the same with her clothes. She wears very plain clothes. And she only wears adult clothes. That is very sad because she loved Dora. She loved all those things when she was little. But we noticed that every time she was using that stuff, she could remember memories and bring her behavior when she was 2, 3 years old, 5 years old. Then it was bringing her bad behaviors, unfortunate. Then that helped us a lot to manage around the public. I was able to start taking her to restaurants. Now I can travel with her. I can do a lot of things with her, but it was a big change for her. What I noticed with her and what surprised me, she's maturing. She feels sorry when she does things wrong. She says, "I'm sorry, Mom." She talks, she has phrases. Then she can tell me how she feels, kind of. She learned to calm herself down with technique. She takes a deep breath. It's very funny, it's very cute. She does. She says, I'm okay, and things like that. Seeing Dr. Levine's talk yesterday, the same thing that Kathryn said, there is too much happiness. When I notice she's getting too happy, I try to remove her because I know the next step is gonna be a tantrum, a breakdown, because she gets her OCD and she just wanna keep doing the same. We make her and we tell her you are an adult all the time, and like I said, like when she dresses, everything, I mean, she dresses like that all the time, dark and everything is very sad, but she cannot wear things that remind her she was a child before, because it just set her up and it makes her happy, makes her proud to be an adult. And she feels pretty happy now. Also surprised me how much she's learning now that she's coming down. Like she's learning a lot of skills, she's enjoying people. People laugh here, some people know she has a boyfriend, kind of. Then she had a meaningful relationship with some other severe autistic kids. Then that's something I never thought I would see it, but it has helped a lot just to change her environment and just decrease how much extra excitement come from outside and just try to decrease that. And that's my story. That's it.